guys, good morning, happy Wednesday. From what I've seen through patterns displayed through my patients and clients is that the last couple weeks have been a little challenging for people energy wise, and some weird not feeling well symptoms going around. So I hope you guys are doing well. I've just noticed because I had a couple more patient reschedules and cancels that I usually don't have. But today we're going to talk about the hip flexors because it's there's a lot of hype around the psoas and the quad and just that grouping of the term hip flexors, and so we'll talk about it a little bit. So what, as people start to jump on here, I'm just going to talk about what exactly are the hip flexors. So the hip flexors are a group of muscles that flex the hip, right? So primarily people think of the psoas, and the two muscles that are primarily thought about with the hip flexors are the psoas and the rectus femoris, which is one of the muscles of the four muscles of the quadricep group. But in the hip flexor group that helps to flex the hip, there are other synergistic muscles that work with the psoas and the rectus. The three remaining quad muscles, the adductors, sometimes help to flex the hip synergistically. The tensor fasciae latae, the gracilis, the sartorius. So there is a grouping through the anterior thigh that helps to raise the thigh towards the abdomen. And why does this matter to us? Because I'm going to highlight the psoas and the rectus femoris today, but understand that there's more hip flexor muscles than just those two, but those are the two that primarily cause the most problems because they're polyarticular muscles, which means they cross more than one joint. So the psoas, for example, originates on the lumbar spine. Sometimes in some people it actually goes up into the lower thoracic, but the psoas muscle starts on the vertebrae and also embeds into some of your discs. So it's right there in your back, and then it travels. It's the deepest anterior muscle, meaning it's so deep that from the front that it's almost in the back. So it travels along the front of the spine. It connects with the iliacus, so that's why it's sometimes called the iliac psoas, right there in the basin of the pelvis, and then travels down and connects on the femur. Good morning, Sophie, it's your favorite muscle. So now that there's a couple more people on, tell me your experience with hip flexors. Can you feel them? Can you stretch them? What's your favorite stretch? Let's just start a conversation so we can help each other. And I'm going to just highlight 5 ways that you guys can stretch it. Although I don't really like the word stretch, because I think when it comes to the hip flexors, there's a little bit more going on than that. And yoga, of course, if you're going to approach it from the yoga philosophy, is more than just stretching or even just releasing, right? It's a little bit more about being mindful of this whole process. So we'll get into that. So the psoas crosses the spine and the hip joint. And then the rectus femoris, which is one of the quad muscles, attaches on the front of the pelvis and travels all the way down and touches on the tibial tuberosity. It becomes the patellar tendon, right? So it crosses the hip and the knee joint. Yes, Sophie, you and many people love that, have a love-hate relationship with that quad stretch on the wall. Maybe I'll show it in just a bit, which is why I'm set up differently today. So the thing about the quad and the psoas, because it crosses two joints, you have to make sure that anatomically the body is set up in a way where, for example, for the psoas, where the lumbar spine is extended and the hip is also extended. And then for the quad, to get into the rectus femoris, the hip has to be extended and the knee has to be flexed. So yeah, you have to make sure that the body is set up in a way to get the muscle in its most elongated position. However, before we go into the more vigorous or physical stretches of releasing the psoas or these hip flexors, we're going to talk about how do they get so tight. And then also what you can do to prep the body to make the body-mind more receptive to stretching. Because sometimes if you force the body right into, that's in yoga, there's like a cajillion stretches of the hip flexors, right? All the lunges, back bends, they'll get the psoas. When the knee is flexed, the quad is, you can get the quad. So through yoga, there's so many postures, but sometimes what happens, I see this with my students and even in a one-on-one setting with my patients, is that the body's going to take the path of least resistance. So if, you know, your ingrained movement pattern, right, or the body's natural tendency is to avoid working through a really tight muscle, or if that muscle is so ingrained in being shortened due to sitting, you know, all these great cardiovascular exercises that we do, so walking, running, riding a bike, those of you that do sit on a bike for many miles a day, driving, all these shorten the quad muscle, most of the hip flexors, right? The psoas especially. And so then what happens is we go from sitting in our car driving to our job, then we sit all day at the desk, and then maybe we hop on the bicycle when we get home and go for a ride around the block or many miles up and down Torrey Pines, or you go for a jog, right? Again, tightening the psoas. Then you come home and you sit on your couch, again, shortened position of the hip flexors. And then you're, you know, watching the tube or reading a book or whatever, and you're like, I feel so tight. And so then you go to vigorously stretch the hip flexors, and sometimes there's like either one of two things happen. There's like a recoil response. The body actually resists the stretching of the hip flexors, or the body completely avoids stretching the hip flexors. And because the psoas is attached on the spine, it'll pull the spine into extension. So some of you yogis or yoga teachers might have experienced this yourself, or have seen your students where, for example, they're doing Warrior One and they're feeling low back pain. And why does this occur? It's because the body is trying to avoid moving through that really tight psoas, and the pattern of movement is, you know, bringing the spine into extension to try to get more space or length, or so you can just stand upright. So how do we work around this, and how do we actually lengthen these muscles that for most of society, most of the time, are in a shortened position? So what I find through my practice is less is more. So the thing about the psoas research is finding is that it's actually innervated by the part of the fibers of the sympathetic nervous system. So that's your fight or flight. So there's even books, one like a book just written on the psoas and all this. And so that feeling, like if we're on a very stressful phone call or having a heated discussion with someone that we care about, like that feeling of wanting to curl in a little ball, or that pit in the stomach of wanting to contract and go inward. Research is finding that, you know, those sympathetic fibers, they're primed to go to the psoas. So the psoas is going to contract, even though we might not actually physically be curling into a ball. The psoas might spasm there, and then if we don't get up and move around and release that tension or that stress or that anxiety, then it, you know, manifests and harbors there in the psoas. So one of the best ways that I find to truly start to soften through the psoas area and start to move in the direction of away from that sympathetic fight or flight response, right? Because that's normal. Stress is going to happen in life. Sometimes you guys heard me talk about this before. Stress is good, right? It helps us to evolve. It helps us to grow. But the problem is sometimes we get stuck in that stress response. We don't know how to move from the sympathetic, that contraction, our body's primed to take flight, mode to the rest and digest. So that's where the restorative practice is really helpful. So using props and bolsters and blocks and setting yourself up in a way, even though the psoas might be shortened, I'll show you an example here, you're still able to begin to soften through the muscles and prime that relaxation response. So if you can have the body and the mind more relaxed and open, then you can move from there into more of the vigorous lunges and back bends and things like that. So if you follow me on Instagram, I'm moving just so I can show you guys some stretches here, or asanas. So if you guys follow me on Instagram, a few weeks ago I showed a setup called Constructive Rest, where the psoas is actually in a shortened position with the knees bent. I'm going to show a different one here with the bolster under the knees. So sometimes it seems counterintuitive, but to actually help the psoas to let go and take tension off the low back, because the psoas can be a big contributor to low back pain, is to give it a little bit of slack. And when the body doesn't feel that tension, that pulling, it also is going to associate that with feeling safe. And when the body feels safe and supported, again, that underlying gripping can begin to recede. So one simple way to do this is to use props. So you can use a pillow or a blanket. These blankets are from Hugger Mugger. I like to use a blanket for a head. I like Hugger Mugger blankets because they're firm. We can go into blanket folding 101 another time. There's many ways to fold the blanket. But just placing the bolster here, which again is from Hugger Mugger, on its tall side. So a lot of times we put the bolster flat, which is fine. But if you put it on the tall side, then that's going to give the psoas even more slack so the body can let go. So very simple posture, just lying on the back with the psoas, or with the bolster under the knees, can help the body come into that relaxation response. So setting yourself up in a way where you feel supported. So even setting a timer, putting an eye pillow over your eyes so it's dark, making sure it's quiet. You can have relaxing music if you want. And sometimes that's a really good place to start a meditation or pranayama practice. So working it with the breath, because science is also showing the breath is a key to start to stimulate that parasympathetic response, or tap into the polyvagal response with that vagus nerve, and through a lengthened exhale. So if you can, for example, inhale for a count of 4 and exhale for a count of 8, research is showing that the body will move from that sympathetic to more of the parasympathetic system. And research is also showing it is like a muscle, this vagus response. The more we use it, the more we train it, then the easier it is to find. The stronger it becomes, the more ingrained into our nervous system. So again, we can move from the fight or flight to the rest and digest, back and forth throughout our day. That's what we should be able to do, right? So first tip, restorative. Second, breath work to help actually move into the relaxation response. So we haven't even addressed like the actual physical lengthening of the psoas yet, but there's 2 ways to start to tap into this different nervous system and move from like our daily hustle, bustle, and grind, right? And the sitting, right? A lot of it goes back to that sitting. So the third way is to start to move to more physical, right? Once the body is in that more relaxed state, or you can still be in the sympathetic, but where if you want to get your heartbeat going, you want to get into more like vigorous postures, so you can still challenge your system. But you don't need to bring along the worries, the anxieties, the fears, right? It's just being in a state of physical challenge. So you can start to move into other postures such as lunges using other supports. So the body again feels supported, so it doesn't have to grip so much. So for me, like since I'm so hypermobile, the best way for me to actually like stretch or relax or release tight muscles is to have the strengthening of my actual muscles. So using my core, making sure I'm not just like hanging out on my joints and my ligaments, and really having a specific focus of what I want to stretch. So for example, if I want to stretch the psoas, making sure that my core is engaged, so I'm not overextending through the lumbar spine, which is what I see happens is people will come into your traditional lunge posture, and they'll really arch through here and the thighs close to the ground, and it looks great, but they don't even feel a stretch through the psoas region. So if they can back out of it and engage the core, see my barrier comes a lot quicker, and now I can actually feel the psoas. So that's more of a vigorous type of stretch, but if you wanted to give yourself more support, then there's many ways to stretch the psoas and even the quad using a chair. So then, you can really tap into the core here, the pelvis being as, square and symmetrical as possible, and you can breathe into the front of the hip. You can even challenge, and bring the arms into the equation, so you're lengthening through the whole side body and maybe starting to get into the TFL as well. And then you can add the quad by lifting the back foot, right? Using a strap, having a pillow under the knee if that's helps to take pressure off the knee. The most common complaint I hear about quad stretches is that it aggravates the knee, right? Because the quad actually crosses over the patella, and it's embedded, and it becomes that patellar tendon. So when I hear that, that tells me, oh yes, and this quad stretch is the perfect thing for you. But you have to figure out a way to modify it so you're not exacerbating the patella on the tibia or the femur, too much pressure there. But there's ways to do that in side lying or padding up the knee. So again, just a review. So you can start with restorative. Hey there, Tina. Chair yoga training. That's a good idea. In the yoga therapy training coming up, we are adding the chair and props and all this sort of stuff as tools, but we're approaching it so, like for example, if you're working with the lumbar spine or the hip, like how would you what's your intention, and then from there, what tools do you need to support your intention? So for example, if you wanted to release the psoas, then you can with a student, you can use the chairs, you can use the wall. There's all these different things, but it's based upon your attention. So just a review. So 5 tips, right, to release the psoas. So starting with restorative, to start to move into that relaxation response. Then enhancing that relaxation response through the breath. Hi there. Oh, I miss you, Miss Watson. Mwah, big kiss. So enhancing that relaxation response through the breath. Then moving maybe into more vigorous postures, still with support, like chairs, blocks. So the body is still supported, but you're starting to be a little bit more active, right? Then from moving there, then you can use no support. So that's more of your traditional yoga vinyasa or flow class. There's so many beneficial asanas or stretches in sun salute, for example, just Tadasana. Sometimes people, they sit so long and so frequently that just being upright in mountain pose can be a stretch for the psoas. So, you don't have to use the support, but again, you don't want to go from sitting and being stressed and anxious to trying to force the psoas to lengthen before priming it, because then it can have that recoil, or sometimes students, during class or after class might feel that low back pain, right? And that's just the body being a little bit resistant. So trying to ease into it. And that's why, if any of you have come to my classes, a lot of the times I'll start in a very grounding and centering posture, whether it just be sitting or in a restorative pose. And I do bring in that breath work in it. It's all this to start to move from the hustle and bustle of your day, the stress response, to helping the body-mind be more receptive to the practice. And I think as physical therapists, we can really bring some of these tools into our practice to help our patients, because a lot of the times it is so much more beyond just the physical, right? When they walk into our clinic, a lot of our patients are bringing all their baggage through the door with them, and then we're just giving them a lunge stretch, and then we wonder why low back pain keeps coming back, because you have to address the root, the source. So the last way is, in some cases, I find I might have a student or a patient that really isn't able to access the psoas by themselves, because it's just so tight and they're so used to it being in that shortened position. Then they try to do the lunge and they're always overextending through the lumbar spine, and they're never feeling the psoas stretch or the quad stretch, for example. Anytime they flex the knee, they're getting that patellar compression and they're having pain in the knee. So the fifth way is through manual work. And that's the type of work I do in the clinic to help the fascia release, give the quad, give the psoas a little bit of space, so then the body can start to feel and associate the difference between being shortened, which is sometimes why the psoas is weak, because if the muscle is over compressed, let's say, or contracted, then those sarcomeres, the Z lines, aren't able to fire efficiently, and so then the muscle can even appear to feel weak. So just through manual myofascial release, to start to lengthen and reorganize the fibers and the fascia. And it's not very, it can be very deep work, but it's not aggressive work. So if any of you have come to my office, I don't just force my way through the tissues, because the thing is if, like the hip flexors, as I mentioned, it's a whole grouping of muscles. And so sometimes if you just blow past that group, or you try to, go very aggressively into the psoas through the basin here, the pelvis, first of all, this is a very intimate area for people, and for someone to press your hands in the abdomen, that can just trigger a stress response, right? So again, you want the body to be safe, supported, feel relaxed. You want to have that rapport and trust, and then ease in, and when you do that type of work, the longevity, the carryover is a lot longer. And then sometimes even after the manual work, I'm like, oh, okay, we got good length here. So how do I know? I usually do a test retest. So I do some kind of test to see the positioning of the psoas or reproduce a symptom or something like that. And then I'll do manual work, and then I retest and see if it was effective, if we made a change. And if I did make a change, and then I'm like, okay, so now we have to teach the body how to kind of re-educate the body on how to use this new muscle length. So then I'll usually bring in one of the supportive yoga postures with the blocks or the chairs, so we can ease into that passive lengthening of the psoas, where the patient or the student really didn't do anything, to them being more active without the body contracting and trying to go back to its more familiar pattern. So that's the 5 ways of how you can stretch or release the psoas. So it's not always about just stretching, right? There's a little bit more going into it, and even the manual work, if you're going to do the manual work, then you want to retrain it in some way. So if you have any other comments, suggestions, stretches, please feel free to leave them below. And I haven't thought of next week's topics, so if you guys have any topics you'd like to discuss for next week, you can comment or message me them. I love hearing your suggestions, and I feel like I'm, having a little bit more of a discussion. So thank you all for joining on, and I'll see you next week. Have a great day. Bye.